about the partial
yes. Joint replacements.
lips.
Yes.
When suppose the other part goes, what?
Absolutely, I've got a choice. I can either just do the other part, or I can take everything out and just do a whole knee, which is usually what I do, depending on the time between the two. But it's not that common to go on for the rest of it to go, I have to say.
Because I was thinking, it's important to go and have half.
Yeah, if the other side. Yeah, because it doesn't usually happen that way. We try and do it so that it doesn't. And the other thing is the redo operation is not such a big thing. And the partial operation is actually a much smaller operation than a big knee replacement, the full knee replacement. And the other thing is you keep all the ligaments when you do a partial knee. And this is what I say, it feels more like a normal knee. So that's my preferred treatment is the partial, because I think people like it better.
I can only see the partial.
Anything else? Any other burning questions? It doesn't have to be hips and knees. I can answer questions about most of the body. I'd rather not talk about backs.
Shoulder.
Shoulder, yes. What can you do at shoulders? It's very similar. Physiotherapy is fantastic for shoulders. Losing weight won't make any difference, but you don't need to. But physiotherapy is the number one thing. Sometimes with injections work brilliantly as well. And the difference with shoulders is that they tend to last. So whereas in a knee, it tends to wear off, as we say, after a short while. With a shoulder, the idea is you have the injection, that allows you to move a bit better, and then everything settles down. So you know, that would be my advice. We've got a brand new shoulder surgeon with us, Mr. Corner, who's fantastic. If things get really bad, I would certainly recommend seeing him.
You have to go
Corner.
You have to go through your doctor.
You do, unfortunately.
Okay.
Yes. Yes.
Hands.
Yes.
Yes. I was diagnosed with carpal tunnel syndrome
Yes.
a few years ago.
Yes.
I had the cortisone injection.
Yes.
Lasted for about 2 years.
Yes. Oh, good.
And now what's happening? I have the experience of a lot of pain.
Yes. Night time. You wake up.
But the doctor said there is some arthritis there because sometimes the fingers just lock and the pain shoots.
If you're getting genuine pins and needles and tingling in your fingers, your thumb and these two fingers, or these three fingers, then it's probably carpal tunnel syndrome. You can have another injection, you can wear splints, and if all else fails, we can do a little operation just to release the nerve, which is a delicate thing, takes 10 minutes. But what we would probably do is see you in the clinic, and there's a special test we can do where we measure how well the nerve works, and that will prove whether the problem's carpal tunnel or not. So you have that first, and then we could decide whether it was arthritis that was causing. Probably not, I have to say. Probably is the carpal tunnel rather than arthritis. You may have arthritis in your hand, but I don't think that's what's causing your pain, just from what you're saying. Yes? Very good question. As I was saying before, some people think it really helps. Cod liver oil is good for you anyway. It's good for your body, it's good for your heart. So I would say, it's got all those essential omega, whatever it is, special oils that's supposed to be so good for you. So I would take cod liver oil anyway. And if you find it helps your joints, then all the more so. There's no real evidence to show that it works, but cod liver oil I think is good for you anyway. And if I can remember to take it oil.
2 years ago, I have surgery my knee.
Yes.
And they started
Yeah.
and from exercise.
And it's good.
And about 2 years now, I'm feeling.
There you go. This is what I'm saying. I see people like yourself all the time. So I don't poo-poo it. I don't say it's all rubbish. I'd say to you, if it works for you, then fantastic. Carry on with that.
My dad is working.
Brilliant. Brilliant. You're going to do me out of business.
I mean, so to build the muscle around.
Yeah.
The muscle builds.
If you build up the muscle around it, that will help absorb all the impact and the energy, so it doesn't hurt as much. Absolutely right. Absolutely.
And what kind of walking would you do?
Walking. What you want to avoid is heavy impact, so I don't recommend running ever. Running on a hard surface is awful for your knees. But brisk walking, fantastic. Absolutely. Swimming, cycling. Most people find breaststroke legs very difficult if you're swimming, but cycling and brisk walking, anything that makes you puff a bit, good for you.
Yes, I'd like to know about the feet.
Yes.
Some time ago I had problems with the arch of my
Yes.
feet. And I found that when I wore high heels,
Yes,
I felt better.
yes,
But when I wore flat shoes,
yes.
I had pains in the
Absolutely.
sole of my feet.
Yes.
So what would you suggest that I do?
I suggest you don't go shopping for shoes with me, because my wife gets very, very annoyed when I tell her about the shoes that she wants to buy, how they're not actually designed for feet. But seriously, you probably find the high heels are comfortable just because that has more of an arch support. What you want to do is buy shoes or wear shoes which actually have a good arch support and a strong heel. Now, that doesn't go hand in hand with ladies' fashion. I totally understand that. The alternative is to get inserts, which I don't like particularly, because you tend to find if you start getting insoles, you've got to keep getting them the whole time. You've got to get this pair for this shoe, pair for that shoe, and you almost become reliant on them. Whereas if you get in the habit of buying shoes that are actually comfortable for you, rather than shoes that look good, it's just an impossible situation. It is fashion, unfortunately, that is the culprit here. And a lot of people find that walking barefoot or walking on flat things is just quite uncomfortable. But the answer is shoes which have a good arch support, that have got good cushioning and have got a strong heel. Sometimes people do have a genuine problem where their arches drop, and there's a problem with the tendon or the there's the thing called tibialis posterior syndrome. The tendon at the back of the ankle here on the inside can actually go, and it does happen to ladies of a certain age. In which case, sometimes you do need treatment for that. But the first treatment is actually something which just lifts up the arch a little bit, and you just, as long as when you I can see the shoes that you're wearing at the moment, so it's basically the opposite of that. so because that's so soft at the sides and at the back, that it just doesn't give anything for your foot, so your foot will just go wherever gravity sends it. Whereas if you've got something that actually pushes up the instep of your foot a little bit, you probably find that more comfortable. So I hope that's some help. But it's a very common problem.
I can't understand though, it's when you have a problem with your bones
Yes.
or your ligaments or your,
Yes.
when you go to the doctor, why they don't just send you to the people who knows about this thing instead of
Absolutely.
having
Well,
one
I'll give you a bit of inside information. I'll get on my soapbox. GPs are incentivised, they're paid effectively not to refer you. Okay? Yeah, and it's going to get worse. Okay, because the GPs are now going to be the ones that hold the money for the NHS. Okay, so every time you go and see a specialist, they've got to pay for it. So it's in their interest to hold you close, and for them just to see you. I know I'm going to make you all very angry. I'm angry as well. But it's in their interest. I'm being a little bit flippant here and a little bit over the top, but to some extent it's in their interest to hold on to you. Now, if you have a genuine problem that needs specialist treatment, then they're duty bound to refer you. But what you have to remember, the first few things I showed you on the slide, so painkillers, bit of exercise, physiotherapy, even injections, they can do all that. You don't need to come and see us for that. If they can get an X-ray, they can get a basic diagnosis. But I think if all of that is failing and you're not getting anywhere, it's going on, you're getting worse, then if you say to your GP, look, we've tried this, we've tried that, we've tried that, I think the time's come to see an orthopaedic specialist. They can't argue with you. They really can't. And if they do argue with you about it, then you have two choices. You've got you can see another doctor for the same opinion. You can see another doctor in your practice, or you can talk to the local health authority as well. There's a backdoor route as well, which I wouldn't recommend, but you can see a doctor privately, a specialist privately, and then when he feeds back to the GP, he can say, look, this person needs to see me, can you refer them on the NHS? And they'll never refuse a consultant.
Well, I'm always having conversation with my GP, because when he gives me something after I've been going several times, and I says, well, this is not working. I says, so he says, well, try this. I said, there's no point, because it's not helping me. So I need to see somebody else.
Absolutely. You need to be a bit, and unfortunately, you have, and this is what it's come to, you've got to take some responsibility, and you've got to be a bit more aggressive with the doctor and say, look, There's not, you know, if you need to get angry a little bit and say, look, I don't mean to be rude to you, I respect your opinion, I really want to go and see a specialist, okay? And then, if that doesn't work, a small letter of complaint, you know, just being respectful, but a letter of complaint to the local practice, you'll see the specialist, I'm telling you. Because at the end of the day, it'll be easy for them then to send you to a specialist and have to deal with a whole load of complaints. And it's sad that it has to come to that, but that's just the way the NHS works, and there is a limited amount of money, and they just can't send everybody. Obviously, the problem is the pendulum's swung the other way, and now they're scared to send anybody. Yeah, you're recording this. I'm being a little bit. I'm really being a little bit over the top. That was just for effect rather than necessarily the truth.
I can take things out if you
The
need be.
opinions expressed are purely my own. I don't speak for all.
I can take things out if need be.
It's
It's fine.
We've seen this on YouTube.
When you have a referral, what is the waiting list?
Well, the 18-week rule still applies. So from the time that your doctor refers you, then that within a couple of days is received by the hospital and it gets stamped. That's the date when the clock starts. And then within 18 weeks, you have to have your treatment. So usually you're seen within about 4 weeks, but it doesn't really matter. You see, as long as whenever you're seen it, you've got to have your treatment within 18 weeks. And so if I see you at 6 weeks, then you have 12 weeks maximum to wait for your treatment, whatever that may be. If I saw you at 10 weeks, then you have 8 weeks maximum to wait for your treatment, whatever that might be. But sort of to see you, get the investigations and do anything I need to do before treating you and the treatment within 18 weeks. That's about 4.5 months. But you'll usually get seen within 4 weeks. And if you need an injection or something like that, if it's a cortisone injection, you can usually have it straight away. The other injections take a few weeks to